The Cutting Edge Benefits Podcast with our host, Tom Quigley of Claim Links. How are you, Tom?
I'm doing well. Yourself?
I'm doing great. Topic today, hospitals are suing patients. What that means for employers. First of all, Tom, before I get to the other questions, I thought it was pretty simple. Hospitals would just go ahead and put a collection out on you and they're done. Not with the high bills, are they?
They hire collection agencies who get paid a percentage, and they're aggressive, and they're taking these folks to court so they can get money. Because deductibles are so high and out of pocket, and a lot of people are going uninsured. They're getting whatever, 20, 30, 50% of what they collect. So they're getting aggressive. What's the most aggressive way? A lot of them are owned by attorneys, is to sue the folks. And that forces them to give something.
Do you think it's a threat? What do you recommend when this happens to your clients? When this happens, your employers
I don't have it happen to my clients because the employers they're buying an insurance plan, a catastrophic, and underneath they're financing it themselves. So the employees generally have very low copays. So there's none of that shenanigans being done. For the most part.
Do you think it's idle threats when they go ahead and have the collection agency call saying they're going to go then to the next level, which is suing?
No, I think some of them actually will go through and start suing because you got $8,000, $9,000, $10,000 bills. You can get that money back. You can if you get half of it. They're making $2,500. It's worth it for them. I don't know what a filing fee is. What, $75? Yeah.
Right. Are employers indirectly funding a broken billing system?
Are employers?
Yeah.
They're buying a health insurance plan that negotiates with the hospitals, and then they're buying, what they're doing is buying a high deductible. So usually the employees are stuck with the high deductibles because the employers are buying it incorrectly, not taking advantage of tax breaks. So the employers aren't covering the out-of-pocket like they do with our programs.
And you know what's interesting, Tom? I think after COVID, finally, I think that the hospitals are losing money now, or they aren't losing money, but they want to profit more. That they were being taken easy on people, and no longer that's happening.
The hospitals' administration's corrupt. Period. They can say what they want to. But the reality is they're overinflating charges, and they're not. A lot of these folks qualify for financial assistance programs that they don't tell you about because they're trying to make money.
How does
Because a lot of them are shares of public companies now.
How does this impact productivity inside a company?
If you're working for a company that has a 5, 6, 7,000 deductible, and you go to the hospital because you have an appendicitis, let's say, and it costs $30,000, and the insurance pays all but $24,000 of it. So you owe $8,000. Well, the $8,000 you owe it, and if you ignore the bills, what they're saying is they're going to sue you. You're better off setting up a payment plan with the hospital to keep the collection out. But most people are fuming because they think they don't understand their health insurance plan. They thought they had a $2,000 deductible, and they don't understand what coinsurance is, meaning they owe a percentage after they hit the deductible up to a certain point. And they're like, why am I getting an $8,000 bill? I'm not paying that. And what the hospitals are saying is, yeah, even though we overinflated it, made money, we're going to still stick it because we can make a lot of money. So we hand it to the collection agency. If we get half of it, it's better than what we would have got.
This question is very interesting. If hospitals are charging 300 to 800% of Medicare, why doesn't anyone push back?
Because you're running with thieves. They're all in the system together, making that millions and trillions of dollars. Yeah, they came up with these reference-based pricing plans, but a lot of hospitals don't take them. The rural hospitals are the ones that may or may not, they're the ones who have more people with Medicaid and Medicare than the public ones, the big ones in the big cities. So they're the ones who are fighting for survival.
So why are premiums rising 8 to 10% annually while employees are still being sued?
Again, you're running with thieves again. These insurance agents and carriers are screwing America. People don't get it. And they don't, and you have to change. You have to do something different. It's not working. So the employers that understand it, I just put one up in Wisconsin, and their employees are thanking the owner, going, "My God, we got great benefits, unlike our friends who work for these other companies."
And
the owner's saving $12,000 a month.
And all they need to do is call Claim Links today. That's it. Call Tom or his team, and they'll take care of you.
Or better yet, you can literally watch videos. I have a PowerPoint for, if you have 6 minutes, you can learn. So then when you're coming in, you can already have done your research, so you can save quicker, so you don't get bogged down with all the inertia that happens within companies.
I think, Tom, there has to be a revolution. I was talking to my team and people I know about Claim Links and how important Claim Links. There has to be a revolution. If everyone would think like Tom and Claim Links thinks, we would have not a horrible healthcare system, at least for people who decide to go to work. And then if you're self-employed, you really have to just watch some of these videos and learn. You got to be strategic. You got to understand the system and talk to someone like Claim Links who will walk you through this stuff, because you shouldn't be paying a ton in health insurance.
You got to understand the tax laws. The tax laws allow you, like I just did a solar equipment. I just got my last 3 years federal tax return money back. And in 24 and 25, I don't have to pay taxes because of the depreciation, which in turn can make my health insurance costs go down to virtually nothing because you're not showing much income. People have got to understand that the tax breaks directly correlate your health insurance today. And the accountants and the tax attorneys that aren't out showing people this, they're like ostriches putting their heads in the sand.
Especially if they're an employee. And there's a way that they could just...
Employees are the worst. They're getting screwed because the employer's making terrible decisions and then asking them not only to partake, but pay. So they're in a lousy health plan and they're paying for it. And I sit there and I'm like, why are you doing this to them when you don't have to?
I think till the system finally shows that if you work for somebody else and you don't have a good health plan, there's no purpose to work at all. You either need good benefits or go do something yourself, join the gig economy, do something else, because any of your profits are going, of what you make in your income is going towards healthcare. It makes sense.
Yeah, if you're making $20 an hour and they're asking you to pay $300 a month to $500 a month for family and spouses, whatever, you're paying that. You're going, wait a minute, my $20 an hour is now $16, and if God forbid I hit a $5,000 or an $8,000 out of pocket, now I'm paying another couple bucks an hour. Now my I'm working for them, I'm giving away $7 an hour. Why would I do that? I agree.
All right. So go to claimlinks.com, schedule a call with Tom today. Appreciate it, Tom. That was the Cutting Edge Benefits Podcast, guys. Take care.